Okay, so to start off, I'm going to read the medical record and more, compare them more with the prescriber's order, and clarify any inconsistencies. Then for all my medications, I'm going to make sure that I know the actions, special nursing considerations, safe dose ranges, purpose, potential adverse effects, and the appropriateness of the medication for my patients. I will enter the medication area or room, gather my supplies, and then once I have all my supplies gathered, I'm going to prepare for one patient at a time. I will also select the correct drug from patient, drawer, or stock supply, comparing the label of the medication with the MAR. I will review the blood sugar obtained, and I'm going to compare that with my sliding scale protocol. I'm also going to correctly calculate the drug dose to determine the amount to withdraw from the vial. Then I will check the expiration date on all my medications. Okay, so I have Humulin R 256. So I'm going to give 6 units of Humulin, and I have my insulin syringe. And it says I have my TB skin test, 0.1 milliliters PPD. So I have tuberculin with my TB syringe. And then I have Demerol, 12.5 milligrams. So I have 25 milligrams. And I need to transfer it to milliliters. So 25 milligrams equals 1 milliliter for my syringe. So I'm going to need half of it. So I'm going to withdraw 0.5 milliliters. Okay, so my MAR check number 1 is complete. And now I am going to go ahead and check my stuff. Okay. Alright, so for my multi-dose vial, I have insulin. So I'm going to make sure that I wipe the safe sealing stopper top with my alcohol swab. I'm going to swab it, and I'm going to allow that to dry. And then as that's drying, I'm going to open my insulin syringe. So I'm going to make sure that I remove the cap. I'm going to place the cap laying face up. And then it says for insulin, I have 6 units to give. So I'm going to aspirate 6 units. Alright, and then I'm going to inject my syringe into my vial. I'm going to make sure that my solution is not touching the needle. I'm going to inject the air. Then I'm going to invert, and I'm going to prepare 6 units of insulin. And I'm going to remove the syringe and needle. I had a couple of bubbles, so I overflowed a little bit, but okay, we have 6 milliliters, and now I'm going to cap it with my hand, or just using one hand, and I'm going to place that aside for my MAR check number 2. Then it says I have 0.1 milliliters of my TB syringe. So again, I'm going to wipe the self-sealing stopper top with my alcohol swab, and I'm going to let that dry. Then, then I'm going to remove my cap, and I'm going to aspirate 0.1. I'm going to hold it still, and then I'm going to inject it, making sure it doesn't touch my solution. Then I'm going to invert it, and I'm going to make sure also that the tip of the needle remains below the fluid level. Alright, so I'm going to release that, and then again, I'm going to single-handedly cap that. And now for my Demerol, for this, if I didn't have a cap on it, I would do the same thing. I would wipe the alcohol swab on it, and then I would allow that to dry. But if I had one that was closed off like this, I would just remove the cap and reveal the rubber seal. Okay, but since I already have it, actually let me pop this. Okay, so now I'm going to prepare my syringe with my needle. Whoops. I'm going to prepare my syringe with my needle, and this is what I'm going to use to draw up my medication. So let's see. And then I'm going to insert my, it's not wanting to cooperate with me, my 18 gauge needle. Or maybe it's me that just can't follow the directions. Okay, so we have that. We have our syringe. We're gonna throw that away. And then we're going to connect that. And we have 0.5 milliliters. So we're going to remove our cap. And I would hypothetically have like a piece of tape that I would insert this in so I wouldn't lay it down, because all of my syringes, I would break sterility if I laid my syringes or needles being uncapped. But it says I have 0.5, so I'm going to insert it. Oh, wait, let me aspirate first. Okay, so I have half. But since we have narcotics, or since we're dealing with narcotics, I'm going to allow all of the solution to be removed from the vial. We can either let the air pressure to fill it, or we can go back and forth with a syringe. Okay, so I would hypothetically waste it to have the 0.5, so I'm just gonna say that I wasted it in here. And I would also make sure that I have somebody in the room with me when I'm getting rid of narcotics. Okay, a little bit more. Okay, so I have that. Now we are going to place our cap back on, but we're not going to use the same needle to inject. We're going to change it. So I would dispose of it in the sharps, and then I would grab my new needle and I would connect it, and I would set this aside. Okay, so now that I have done that, like I said, I'm going to not break sterility. I'm not laying any syringes or needles down without the cap. Okay, now that that's done and I've changed the injection needle, I am going to do my second more check. So again, I have Humulin 7 units. I have Humulin 7 units. Then I have TB skin test, PPD, Tabersilin 0.1 milliliters. Then I have Demerol 0.5 milliliters. So my empty vial and my 0.5 milliliters. Okay, so now that that's done, I'm going to make sure that my medications are in sight at all times, and I'm going to head towards my patient's room. So I'm going to enter the room, introduce myself, perform hand hygiene, then I am going to identify my patient according to policy. So I'm going to ask for name and date of birth, and I'm going to compare that to the identification bracelet. It matches, so now I'm going to assess patient's medical history, allergies. It says he's allergic to morphine. We're not giving him any morphine, so he's good. And then we would check for any necessary physical assessments. We would check for blood glucose levels and pain levels, but he does not have any, so we're good. All right, so now we're gonna do our last more check. Again, Humulin right here, 7 units. TB skin test, PPD 0.1 milliliters. Tabersilin, TB syringe. Demerol 0.5 milliliters. Empty vial 0.5 milliliters. More check number 3 complete. And now I would read my 3 note cards and share the purpose and side effects of all 3 medications, and I would allow my patient to ask any questions. Okay, so now that that's done, I am going to prepare for my injections. So I have my alcohol prep pad. I'm just going to repeat this once and I'm just going to say that I'm doing it. Okay, so for insulin, we're going to inject in the inner forearm of our patient's right arm, hypothetically, and then we're going to clean our site. So with our alcohol swab, we're going to clean from inner to outer of our injection site, and then we're going to allow that to dry. And as that's drying, I'm going to remove my cap. And then for this one, I'm going to stretch the skin taut over the injection site. And then for my insulin, I'm going to basically insert it flat on the patient's skin. We want the bevel side up, and we want to insert it at a 5 to 15 degree angle. So we're going to hold it, and then small angle. We're not going to go too far. We're going to release. We're going to insert our medication slowly, and we should see a wheel form. So there's like a little hole. Then we're going to remove it the same way that we inserted it. So we're going to remove it the same angle that we inserted it. Alright, now that that's done, I would cap my safety gear. So I would safety gear it with one hand, and then I would place it in my sharps. So it would look like this. So I would hypothetically do that. And then next up is my TB skin test. So again, for TB, we're going to place it on the patient's right posterior upper arm where all the fatty tissue is at. If we did have a patient that had more subcutaneous tissue, then we would insert our needle at a 90 degree angle. But since we don't, we're going to insert it at a 45 degree angle. So for this one, we're going to, again, remove the cap. This time we're going to pinch it at the injection site. Okay, what we're going to do, bevel side up, and then insert. Then we're going to release the skin, and we're going to slowly administer our medicine. Then we're going to remove it the same way that we inserted it. Again, I would safety gear it and then put it in the sharps disposal. And then last but not least, I have Demerol. For Demerol, we are going to use the Z-Track method. We are going to remove our cap. And for this one, we're going to kind of hold our skin to the side, and then we're going to insert it at a 90 degree angle. We're going to do it fast and quickly. So my subcutaneous injection is right there, so we're going to do it right here. Let's do it down here further. Alright, so we're going to go like this, and then as I'm still holding the skin, I'm going to insert my medication. I'm going to wait a few seconds, then I'm going to remove my needle, and then I'm going to release the skin. Again, I would safety guard it and put it in sharps. So I now have my intradermal, subcutaneous, and intramuscular injections done. After I do this, I would remove my gloves. I would discard all of my supplies. The Demerol would also go in the sharps container since it is a narcotic, and we would document all of our medication that we administered into our MAR. We would also evaluate the patient's response to all the medications, and we would maintain the 6 rights of medication administration. So right patient, right medication, right dose, right route, right time, and right documentation. and we know that if we compromise one of those, we would break the administration or the medication administration rule. But last but not least, our intramuscular injection sites. So we have our deltoid, we have our, you can palpate right here, and it's our bony prominence right here. So we place 2 fingers, and then our injection site would be in between my middle finger and this finger that I can barely lift. So it'd be in between these 2. So it'd be right there. And then we have our vastus lateralis, which would be on our hip. We would place our index finger on our anterior greater something bone. And then we would place the bottom of our palm on our great truncator. And we would basically be like this, and we would insert the injection right here on the hip. And then we have our ventrogluteal, I think that's how you say it. We would do that, no, I have it backwards. Ventrogluteal vastus lateralis is on the hip. So on the hip, we would place one hand below the great truncator, one hand above the knee, in this little window that we would have on our thigh. It would be inserted laterally, and a little bit closer towards the knee. But that's it.